Now, this will now first two lectures usually we record and I'll send it to you because first two lectures may first two lectures may we understand about the basic things about pharmacology. Now all of you are there for pharmac, right? So do you want pharmac or do you want patho ka demo? What is that? Do the demos right now. Okay. So let me first make you understand the technique we're going to go through. And I think I'll be spending at least 15 minutes on the mechanics behind learning the lectures, because these lectures are not designed for your exams. So are you going to give exams out of this? Pharmac exam, patho you can give an exam. But these lectures are designed primarily to make you practice well. So we have so many years when we are doing it, we also have been teaching to the general practitioners these days on a large scale because a lot of GPs are asking for it. So what we have understood that there are two basic. Now don't write it down. When I ask you to write down, that time you can completely concentrate on what I'm. Now today we're going to learn about the mechanics behind learning how to practice, because the most difficult thing to teach is how to practice. Why? Because there is no book who can teach you. And why somebody cannot write a book on how to practice? Do you know why? Because practice is always not 1 plus 1 is equal to 2. Theory is 1 plus 1 is equal to 2. I can teach you appendicitis. I can teach you pneumonia because that is what is 1, 2, 3, 4, 5 points. But when it comes to symptoms, there is no one. Every symptom can be some other disease. Even a cough, cold, fever with very high respiratory rate, with infection in the lungs can be something else also. And because of that, it is most difficult to teach how to practice. And because of that, no book is designed for that. Hardly any book which is designed, because practice is learned by an experience. But in these lectures, we're going to make you aware about, because there are two phases of what I'm talking about. The first phase is this, what we are right now. In the first phase, we're going to learn about the phase is designed for a clinical pharmac. Of course, this is usually these lectures are supposed to be done in at the end of your second year, maybe during your second year or third year, before fourth year. That is what I think. Because in these lectures, what we are doing is last 7-8 years now. These lectures we will be. It is not only pharmac, because pharmac is all theoretical. Drugs kashe kaam karta hai and what dose and what route and all those things. This is clinical in the sense we're going to learn when we are teaching you the drugs, we will also be teaching you the disease. For example, I'm teaching you an asthma. We will not go to the anti-asthmatic drugs 1, 2, 3, 4 that you can Google and you can find out. The most important thing is how do you relate that drug with the disease? Because asthma, we all know, comes with cough and breathlessness. Right? There are two symptoms, cough and breathlessness. Are you all in the second year, third year, fourth year? Second year, third year, even third year, right? Third year and beyond. Right? So thoda sa jasta clinical, because second at the point of second year, thoda jasta clinical becomes on overdose. So let me make myself aware. Where are you right now? So cough and breathlessness. So the drugs are supposed to be given for cough and breathlessness. One of the cause of cough breathlessness is asthma. So when you are learning the drugs, we are also going to learn about the disease. But this is vertical learning. Cough and breathlessness can also be because of lot of other causes. The patient is not going to come to you with asthma. Patient is going to come to you with cough and breathlessness. When you are aware about these things, believe me, then the learning should be horizontal. I mean to say, then we start from cough and breathlessness. Now, cough and breathlessness can be an asthma, can be COPD, can be tuberculosis, can be pleural disorders, can be even an MI also. Have you heard about cardiac asthma? परंतु हे second phase horizontal learning कधी कळेल? When this is learned. It is not possible. Now, usually when you start and go and see the patients at this stage, I always do not recommend you to see the patients at this stage. See, internship is designed when? At the end of your fourth year. A lot of students will ask me, sir, kidhar, do you have any clinic? Can I come down here? First thing is to know about the drugs, diseases, and all those things. Because patient will come to you with symptoms, right? It is not very easy to interpret the symptoms. When we start with cough and breathlessness, the whole board is full. And at the end of the cough and breathlessness, you go so confused. Ki kya rahega? Initially, we are confident. For example, when you start with vomiting, vomiting is just a symptom. Vomiting ke liye there are n number of causes. That is what is horizontal learning. Symptoms learning. Because when you understand this, how do you interpret the chest pain? How do you interpret the breathlessness? Some points I'm going to discuss in this particular stage because it is difficult to teach you horizontal and vertical at the same time. It is like, for example, you're traveling from Dadar to Virar. At one time, you can learn about the upgoing stations and then you can learn about downgoing stations. Is it possible to learn both these stations at the same time? You become more confused. So this is what the first, for the clinical, I don't say this is the pharmac only, it is a clinical pharmac. Because here we're going to learn about the clinical symptoms and their treatments or the disease. So everything will be oriented around the drugs or drugs related जो भी disease है, that will be covered. So indirectly what we can say, medicine part is also covered in this. It is not only the drugs but also the medicines. But ideal medicine is what? This clinical features. We have designed about 80 to 90 cases in which the most common case. Now those cases, if you analyze, those cases with the most common patients coming to you, at least 60% patients त्याच्यातले जाणार. Like for example, we have asthma का case, we have angina pectoris का case, myocardial infarction का case, heart failure का case, psychiatric disorders का case, and all those cases will be different. But that will be a second part, is what we can think. So this is what makes you, and then when you know how to analyze cough and breathlessness, अगर कफ पहले आया breathlessness बाद में आया तो there is different diagnosis. अगर breathlessness के बाद कफ आया तो there is a different diagnosis. अगर कफ में एक्सपेक्टोरेशन इतना निकलता है तो there is a different diagnosis. इतना निकलता है ज्यादा, a different diagnosis. Color of the sputum gives you different diagnosis. It is difficult to teach you both the things at the same time. Ideal thing would be, along with this, if you learn pathology, an ideal thing, ideal combination. Because you're going to learn about what is happening as an abnormality in the organ, the disease, as well as the drugs. This becomes one part. And a lot of people directly join the second. It is difficult to analyze things when you don't know the disease. अगर तुमको पता ही नहीं है कि कफ ब्रेथलेसनेस कौन से disease से होने वाला है, so how do you analyze the symptom? So first thing is this, and I want you to remember these things for how much time? Usually, when we read anything, how much time we target it to be remembered? Maximum 1 year till the exams. Most of the time, of course, that is not a, I mean to say, uncovered story, something like that. Everyone tries to remember things only till the exam. The moment exams are over, याद आता है कुछ? No, because we plan to remember it only till the exams. It is like, for example, you are reading a number from a diary and you are dialing it. How much time will you remember that number? Only till you dial it. After you dial the number, do you remember the number? Why? Even if it is 5 seconds before. Because you plan to remember it only till that particular time. See, it is all, nobody is good, nobody is bad in the memory. It is all how you plan to remember it, or how do you utilize your mental power with that. Everyone standing at the same. We have seen those who are average students are very good practitioners, and we have seen those who are toppers may not be a good practitioner. So success is not always the intelligence. Success is always how you apply things. Was Einstein an intelligent guy? No. Absolutely not. So he became successful. That's another story. So I want you to remember these things before we start anything. For how much time? This rest of your life. At least till you start practicing. Because when you start practicing, that time it will be automatically remembered. But till you start practicing, you will have to see who is a good practitioner, who knows, who can diagnose things. What is more important, diagnosis or treatment? Diagnosis. What is most difficult, diagnosis or treatment? Diagnosis. And how can you make a diagnosis? Just by knowing the clinical features. And you come to know कि clinical features में कहाँ पे problem हो सकता है. To understand that clinical features, you need to know about all the diseases, right? कि chest pain कौन से causes से हो सकता है. If you can Google and find out, they have got all those theoretical charts. Go and find out differential diagnosis of chest pain, and Google will give you n number of differential diagnoses. But it's difficult to interpret that also because it is all the rare causes also. You will learn about most common causes. Of course, in the second phase I'm talking about. In this, we want to learn about the drugs and diseases. Some of the points, if you have understood things well, believe me, the depth of teaching will be depending upon you. We don't come and by heart the lecture and deliver the lecture. ये format है. If you're taking more interest, we can go a little more deep. Because I don't want you just to know how much knowledge I have. We will go to the depth. You will allow me to. If you're asking doubts, we're going to go to a little more depth. If you're not asking doubts, if you're not revising it properly, monotonous lecture hai, so it automatically becomes superficial because there's no point in going more deep. We can teach you till at least 2 levels depth than where you are right now. So take interest actively. Ask doubts because we have got a very good experience in teaching the general practitioners. I'll show you the photographs in which 40 GPs are attending our lectures who are practicing in the last 30 years. So we are also teaching them, but of course their depth is little different. We might as well go to their depth if you allow me to. We don't come with ये topic cover करना इतना topic. Of course, number of topics are given to you, those topics will be covered, but the depth will be decided by the interest will be taken by this class. So आपके पहले there was a batch of Mittal students, good students. We have taught at least 30% extra to them because they could revise it, they could understand those things, they could apply. The most important thing is an application. We're not going to teach you any definitions here. We're going to teach you only concepts, and concepts need to be applied. In the same thing, we also go through a little bit about physiology because to understand pharmac is important to know. So I'm going to giving you an idea about in 10-15 minutes what I would so that you can be mentally prepared. The topic which will be I think most of the time will be go the same sequence given in the list so that you can also come prepared with the topics. If you have some books, if you are reading from some notes, you can come prepared. So physiology, pharmacology, medicine, and if you take interest in pathology, this will be covered in these lectures so that you can understand about the disease, understand about the clinical features of the disease, understand about the drugs for the disease, understand about the physiological part of the disease. And then if these things are prepared, you are ready to analyze the symptoms. Before that, if you see the patient, what will happen? Is it easy to ride a bike with both hands out of the steering or handle? But people do it, right? When people can do it? Only after they master the regular basics. On first day, I will not teach you to take down the hands. It is easy to take down the hands. But what will happen if you don't master the basics? Accident is going to happen. So don't try to see the patient at this stage. This is what we think. When those PhD people have designed internship after the 4th year, there has to be a reason behind it. A lot of people, because I include usually this in my first lecture, because a lot of students do ask me, sir, clinic join karna hai, kahan pe karu, all those things. At this stage, believe me, it is not required. If it would have been required, government would have designed the internship from the first year itself. Patient देखो, finally 1 साल में doctor. It is easy, right? 1 साल में तो 100 patient देख लिया हर किसी का एक तो हो गया doctor. Because every patient doesn't come copy pasting the next patient. Will first MI patient come with the same like a next second MI patient? It can be completely different diagnosis, completely different clinical features. So how do you know that this is an MI? Learning the basics. Then only the thing is going to be possible. So remember, there's a technique behind it. You need to follow that particular technique. What is the thing I can think of different between your college lectures and these lectures? You always say in the first lecture that we want you to remember these things. थोड़ा सा shrink होगा लगे, if it is possible. Otherwise, you can also take these chairs. There are a lot of chairs here. है, चलो बस रहे थे, इधर बस हाँ. Take the chairs and थोड़ा shrink हुआ. You can shrink. बस. पुढे आहे जागा. Take the chair. Okay. Okay, get settled. Take. पुढे जागा है. I'm not going to ask you questions. No questions will be asked. Okay. अजून इथे पुढे टेबल सकट जागा आहे. So where was I? कुठे होतो मी? Okay. There is a difference between college lectures and these lectures. First thing is, I don't have any internal marks in my hand. I don't have your attendance in my hand. There won't be any exam out of this. So, are you ready to learn those things? The exam is not there, internal is not there. In fact, what we can say, with this, you have the biggest exam of your life, of practicing. That's what we are preparing you for. We're preparing you to practice well. We have seen a lot of times a regular general practitioner who is a just graduate is seeing more patients. Patients are trusting him more than the specialist. It is the most difficult to be a general practitioner these days, because a good general practitioner has to know at least 20% of all systems, because it is easy to be a cardiologist, practice like a cardiologist का कारण मला फक्त हार्टच बघायचं आहे. But it is not possible because human body is not fitted spare parts together to make a human body. Every system is depending on the other. आपल्याला हळूहळू लक्षात येईल की चेस्ट पेन इज नॉट ऑलवेज कार्डियक. कार्डिओलॉजिस्ट काय म्हणेल, ऑल चेस्ट पेन्स आर बिकॉज ऑफ कार्डियक, कारण त्याला ते माहितच नाही, 5 वर्ष त्याने काहीच बघितलं नाही दुसरं काय. सो ही इज गोइंग टू अनालाइज अकॉर्डिंग टू हिम. A general practitioner will analyze properly. You know who is the most highly paid doctor in a USA, UK? Is the general practitioner, who is a family physician. Because there are more specialists than GPs. Patient, how do patient come to know कि cardiologist कडे जायचं की respiratory कडे जायचं? GP is going to tell him, right? How do patient ला काही basic knowledge आहे का? Heart attack म्हणजे काय? For example, you going to cardiologist. So first thing is, how will patient go to specialist? Only when patient understand कि about क्या problem है, and who will make him understand? The GP will going to make him understand. That is why family physician concept came up. And who is the most successful GP? Who at least knows what 20% all specialists will know. 20% I'm talking about. It's not possible to know everything, but at least 20%. Because it is the GP who diagnoses the disorder. If you diagnose things in time and refer the patient in time, the surgeon will operate. Who will the patient bless more, the surgeon or you? GP, because he has identified it and sent it in time. Remember that the most rewarding thing will be a general practitioner. And how do you be a good general practitioner? Knowing all those disorders altogether. Of course, हे सगळं भगवद्गीता आहे, right? The real thing is what is Mahabharata, what is Rama, real fight. That is what is the topic, right? This is what is I can say melodious words. Ideally, as a wild and all this. So you're going to learn all those things. So I want you to remember these things for rest of your life. I don't want you to remember for a few days. And because of that, we are here from. And we feel happy when the students want to learn things even without their exams, because it is where the interest is there, and it is where is willingness to learn something which is really going to matter in your practice. Because how to practice, how to identify symptoms and all, it is difficult to. All of us know theoretical knowledge and practical knowledge is completely different. A lot of times you will find that what we are teaching may not be relating in the books, because when the last batch was finished, I asked them my opinions about the lectures. Few of them were telling me that, sir, what you teach doesn't relate in the books, because books are designed as a theoretical one. Practical things are different. So we go to, this is what a clinical pharmacy. There are about 10 to 20% things which may not be relating in the book. Book may say that this drug need to be prescribed, but practically you don't prescribe. That's what we're going to learn. So sometimes book may not relate it to you. Whatever we are going to teach you through this, if you're taking down the running notes, that will be good. And how do you remember things for the rest of your life? How many of you have memory, one time learned and lifetime remembrance? एक पार्टी म्हणतो ना आपण, एक पार्टी, what is that? We all forget. In fact, forgetting is more important. What is more important, forgetting or remembering? Forgetting is more important, remembering is more important. Believe me, whatever things you are doing, today be prepared for a little more time, because we are spending a little more time on this. But this is what is the software. Before processing the data, we need to install a software. And त्याच्यानंतरच data जाणार. Only data has got no meaning. So whatever things we learn, we forget in how much time? I can say 90% going to forget in 24 hours. If we are remembering everything what is happening in a day in the brain, within 1 month the brain will get clogged and you won't be able to analyze anything. So forgetting is more important. So what you remember is only thing that is urgently important. You must have got an experience that when you read during the exams, it is remembered better than when you read without an exams. For tomorrow, कल इसका एग्जाम है, तो आज अगर पढ़ते तो कल तक याद रहता है. Because we prepare yourself for remembering that much time. So 90% हम लोग 24 घंटे में भूल जाते हैं. We forget 90%. If you see 7 days, 95%. Whatever we read, we forget. But what is, for example, you have seen some patient and you could analyze the symptoms well and you could treat the patient well. How much time you going to remember that? Why you want to forget the patient or symptoms and all? No, why? This memory is 90% forgotten. The other memory is because that is what you have understood it. So my goal will be to make you understand things rather than make you remember things. Because when you understand it, knowledge becomes automatic. You automatically gain in more and more knowledge when you understand concepts. So concept, because there are a lot of things when you're reading the book, concept is not explained that well. Who is going to make you understand the concept well? There is a novel on one side, there is a book on one side. What will you prefer? If there are no exams, a novel or a book? Novel. Why? Because novel will make you understand things. When you read the first page, you automatically get glued to it. Why do you get glued to it? Because the first page itself, they make us understand that what is there in this gist of it, and then they start it. Are the books designed like that? Because books are written by academic people, novels are written by artistic people. Both cannot be together. Intelligence and artistic nature, both are different. So when we understand it, then only way. For example, you understood how to come to my place. Are you going to forget any time, at least for next 2 to 3 years? Because you have understood it how to come down. If I would have told you USA के स्टेशन से व्हाइट हाउस कैसे जाने का, will you remember it for half an hour at least? कल तक याद रहेगा? Because you have not understood it. Understand the difference? मैं आपको without even coming here, if I told you कि यहाँ से ऐसे आने का वैसे आने का, रिक्शा पकड़ के गैमन हाउस के स्टॉप पे वहाँ पे हॉस्पिटल है. You may not be able to remember it well, but you have understood it, then you are able to remember it well. So make it a point that understanding remains. What is getting forgotten is the theory. So this is what we are going to concentrate more on. If you understand it, when you read from the book, automatically more knowledge will come up. For example, I'll take the last word and we can finish this initial introduction. That if there are, when you go to library, we choose a particular book. For example, let's say there was a cricket ka book, there was a political ka book, and there was an Femina Miss India ka book. You will choose the book to be read, depends upon what? Your choice, depends upon what you like. Why do you like it? Because you have more knowledge in it. It is not possible that I don't know anything about politics, but I like to read it. It will not happen. If there is a PHARMAC book, will you take that out? Never, because you understand nothing about it. And the moment you start reading, it becomes like sedative, sleepy. So you will take that book only if you want to sleep. So believe me, and when you, for example, you have some knowledge about, let's say, politics, and you take that book out, what do? You read through it, you get more knowledge. When you get more knowledge, you are more attracted to it. When you're more attracted to it, it creates rather more knowledge. So what happens? It becomes automatic, right? It becomes automatic. So can the same thing happen with medicine? Can it happen? It should happen. But does it happen? No, because very less number of times we are made to understand the topic. When we understand the topic, believe me, understanding takes more efforts. But if you understood it, the knowledge becomes automatic. The moment you read some book, you'll get, okay, yeah, yeah, ऐसा है क्या? I think you're going to relate those things. And that is what is my target. And we will be able to achieve it. Because we are doing it for 7, 8 years, 8, 9 years now. And we know exactly what can be more important at this particular stage. So take active interest. That is what my word of say. Second thing is, within 24 hours, this is what is the most important thing. And I'm going to call it end of the introduction. At least within 24 hours, because this is what you're going to practice in. Within 24 hours, whatever you're going to note it down, at least let it run under your eyes once. Within 24 hours, make it a point. See, everyone is same in this class. It is not like somebody is a topper, somebody is a non-topper. Doesn't make much difference. If you follow the steps, you're going to remember the same way what others are able to remember. Within 24 hours, make it possible that you are able to go through the topic once. हम कितना टाइम लगेगा 2 घंटे का लेक्चर को रिवाइज करने के लिए? Half an hour भी नहीं. Believe me, you can do it. In fact, it is my habit that every lecture we do quickly revise, go through the next previous lecture. This is my, otherwise I cannot because I also want to come on the track and then I can run my train. So to make me come on the track, I will have to revise and ask you where are you standing right now. But make it a habit that you also do it at least within 24 hours. Like ideally, the second should be there within 7 days. Let it run under your eyes. If you are able to do it, you are able to remember it for 1 month. It is not an insurance. Ek time premium and lifetime security. This requires an habit to be made. Of course, I don't require it. आज सोमवार है, आज करने का ही है. Doesn't make much difference. सोमवार का मंगलवार. The more time it passes by, इसको first revision करने के लिए, believe me, only 10 minutes. ये 7 दिन के बाद करने के लिए only 10 minutes. If you read it 1 month, again 10 minutes only. But if you directly open it at the end of 2 months, 2 घंटे का लेक्चर समझने के लिए 4 घंटे लगे. Because ये क्या लिखा था समझ में नहीं आया, for example. And the road is get blocked. Because we are not going to give an exam on this. Exam is a very smaller goal what we can keep for ourselves. Most important thing would be, and believe me, with this thing, if you can practice in a rural area, you'll be the topper. Make my word, take my words. In Mumbai, still it requires more skills because Mumbai the competition is very high, the patient's expectation is very high. Patient's knowledge is also very high. Patients are also, because everyone has got that Google doctor. Dr. Google, he can very well find out, I have got a chest pain. So causes of chest pain. Today's days not even need to write in English. You can just talk. And Google will say these are causes. He has to study only one disease. So make it a point that at least we are one step higher than him. ना तो वो बोलेगा सर डिफरेंशियल डायग्नोसिस में तो बताया कि ये भी है, तुमने ये नहीं देखा. मैंने बोला मैं 2 मिनट में आता हूँ. And then we can go. और भी मदद लेवल म्हणतो तू बाहेर बैठ. तू मुझे बाहर मिल. So make it a point. So these things are really going to make a difference. At the end, we will make it a habit that at least every month we're going to give thoda sa exams. I had not given an exam for any of my batches till now, but last batches have suggested me to take an exam. So we'll make a group college-wise, and then we can ask you some questions, ask you some situations. What will you do in that particular case? Will not be a theoretical question to define this and define that. Doesn't make much difference. Definition. Do you remember definitions? The most successful cardiologist doesn't remember the definition of a cardiac cycle. Doesn't make much difference. But he understands everything what cardiac cycle is supposed to do. Do you know the definition of a doctor? There is a half-page definition of a doctor, a general practitioner, or maybe a physician, registered medical practitioner. We don't know. Nobody knows, but all of them are practicing. Definitions are only important for the exams. What is more important would be to know the gist of it. समझ लो? So initially I'm going to take sort of PHARMAC part. Maybe the double thing. So prepare yourself for a little more time. I am free for this. I will not keep anything after this. So let's say how much ever time it takes. I'll make you understand 2 important topics so that we can decide about. Because what we are thinking about these lectures, that a lot of people are also asking for pathology. Because at this stage you need to also understand about pathology. So we are also planning to include pathology along with, of course, as a separate topics. Some pathological clinical things will be covered during the pharmac only, but a lot of topics are also different. So we are planning to have a pharmac first during the lecture, and the second half pathology. That is what we have planned. Then let's see how it goes. So currently, now let me go to the most important, the most basic topic. Now we are also recording it for, I'm going to send it to you, because these 30 minutes, according to me, is going to make a little bit change in the way you're going to. Now, preferably take down the running notes we have, if you have a notebook, or maybe you can take down the running notes, maybe afterward. If today, if you're not ready with the lectures, you can also see the video later on and then you can write, don't worry, because this video is going to be forward to you. First two lectures I'm going to forward, so that those who are joining late, because usually people are busy, people say आज तो demo है, बाद में जाते हैं, for example, so that we can, because make it possible that you don't miss any lecture. Why? Because every lecture का topic I am going to take the related topic afterwards. अगर एक station miss, make it a point. Of course, somebody will miss some of the lectures, but at least make it a point that you read through those particular topics and ask me doubts in the next lecture. कि सर ये कैसा था, मैं अटेंड नहीं किया था, मैं समझ नहीं पाया, can you make you understand quickly? Right? Make it a point that you don't miss any lecture, because every lecture will be designed in such a way that you understand the next topic well. समझ लो? So let me go to the most basic thing in pharmacology. Most basic thing in pharmacology. Now today we're going to learn about at least the general concepts in pharmacology. Now these general concepts are the most important, because this is what the whole pharmac stands on. The whole drug stands on. In these are the concepts in which the whole pharmac will stand on. So this will be the most important thing, and I think you should revise it at least twice or thrice, so that the base becomes well. The concept we are going to discuss, the use of this concept will be in every chapter, every topic we're going to learn. So it is like, I can say, skeleton of the pharmacology. So make it a point that you remember it well, and because of that only we do forward these lectures to you, so that you can understand things well. So general concept. Listen, now we're going to learn about what exactly will happen when any drug is consumed. Any drug is consumed. Last benches can see this time, no? Otherwise make me know, so I can increase the hand, and of course thoda sa it will be non-legible, thoda sa fast to me, but if you are able to understand it well, good. So who is a good doctor? Who has a bad handwriting? No? Okay. Now today we're going to learn about what exactly is going to happen when the drug is consumed. Now we're going to go to the base. Now what is the most common route by which drug is consumed? Most common route by which drug is consumed is the oral route. So today we're going to learn about basic concept about what is an oral route. Now what are the formulations? All of us know. Oral route में कितना formulations है? We have tablet form, we have capsule form, syrup form, we have powder form, we also have a suspension form. Any of this is what is an oral route of drug administration. Now we're going to learn about what basic things going to happen when the drug is consumed. I'm not going to go to any theoretical topic, but every word or every sentence in this, let me know if you're missing the train. If your hands are slipping off, let me know, because every word of this will be used in the next topics. Let's say I have consumed a tablet, oral route. I'm going to learn about, make you teach about the other routes, but let first make me understand about the oral route. So when the drug is consumed by the oral route, what does the stomach do? Stomach will first disintegrate it. It's only for adults. ये अलग है क्या? So stomach will do what? Stomach will dissolve the tablet. Is the stomach meant for absorption of the food? Stomach is not meant for absorption of the food. The stomach will make the powder, or maybe molecules will be dissolved. Stomach is not made for, only few drugs are absorbed from stomach. Like for example, you should know alcohol is absorbed from the stomach. Alcohol is a drug. It is a very good drug. If you decide the dose, not the patient, alcohol is a very good drug. And we also have an aspirin. You must have heard about. See, these are the acidic drugs. What is the pH in the stomach? Acidic. So acidic drugs will be absorbed from the acidic environment. Acidic drugs will be absorbed from acidic environment. Only two drugs, but 99% of the drugs are not absorbed from the stomach. They go to the small intestine. Of course, it requires some time for the drug to go to the small intestine. It depends upon the gastric emptying physiology. Depends on the stomach. How does stomach empty? What will happen when the drug goes to the small intestine? Then it will be absorbed, right? Small intestine is meant for what? Absorption. Where will it go? Think about anatomy and physiology. Where will this drug go? Directly to the blood circulation or go somewhere else? Every food that we yes, every food every first goes to where? We have a separate circulation called as a portal circulation through something called a portal vein. You know that inferior mesenteric vein, superior mesenteric vein, and this is a separate channel. It doesn't go to blood circulation directly. It first goes to liver. Why does it go to liver first? Because liver has got all chemical factories, all chemical enzymes to digest this, and then after the digestion, it is circulated all over the body. I'm talking about the food. Let's say if you have two gulab jams, it goes to the small intestine, it is absorbed, goes to the liver. What does liver do to the gulab jam? Gulab jam mein kya hai? We have carbohydrates in the form of maida, we have oil in the form of, because gulab jam is fried, right? And then we have some proteins also. What will liver do? Liver will make all molecule separate. कार्बोहाइड्रेट को अलग करेगा, प्रोटीन्स को अलग करेगा, फैट को अलग करेगा. And what will it do to the carbohydrates? कार्बोहाइड्रेट को भी सिंपल मॉलिक्यूल्स में कन्वर्ट करेगा इन द फॉर्म ऑफ ग्लूकोज, फैटी एसिड्स एंड योर whatever food you're going to have, even if it's gulab jamun or even if it is vada pav, it ultimately becomes what? Glucose, fatty acids and amino acids. Who does it? Liver does it. Because liver का function क्या है? To break the complex molecules to simple molecules. Of course, I'm not teaching you nutrition here, but there's an importance. When you consume the drugs also first goes to, I'm talking about oral route. Drugs also first go to liver. What will liver do to the drug? Again, liver will also do the same thing. Liver will not understand your drug है कि chemical है कि food है. Liver will also break down the drug to simple molecules. Let's say this was a drug. What will liver do? इसको अलग करेगा, इसको अलग करेगा, and that is what liver is doing to the food, right? So what is my word of say here? That the drug molecule is broken down to simple molecules, right? Will the drug remain a drug after it is broken down to? For example, we have an acetyl salicylic acid is a drug. When it goes to liver, acetyl अलग हो जाता है, salicylic acid अलग हो जाता है. Because that is what is the function of the liver. So when the liver acts on the drug, about 80% drug is destroyed. I can say destroy here because it is not digested. Food is digested. Drug will be. Why destroyed? Because it will be broken down to simple molecules. Acetyl अलग हो जाएगा, salicylic अलग हो जाएगा. About 80% drug is destroyed. So what will happen? The part of the drug that is not destroyed, कितना है? 20%, right? That will go to, from the liver, where will it go? From the hepatic vein, it will go to inferior vena cava, heart, and will be distributed all over the body. Because see, we give drug for the drug to act on the body. Let's say I have a wrist pain here. I have consumed the oral drug. First, it will go to stomach, disintegrate, small intestine, absorb, liver. Liver will break down. This liver breakdown is called as a first pass metabolism. First step was dissolve. Second step was absorption, right? Third step was first pass. Fourth step क्या होगा? then it will be distributed all over body. Then it will be distributed all over body. When it will be distributed, what will happen? Then it's going to act on the body, right? Will it act on the body before it is getting distributed? Is it possible for the drug to act on the body before it is distributed? Let's say I have a joint pain here. I have taken the drug. Drug is still there in the liver. Will it act on the body? Either act करेगा कि नहीं करेगा? It will only act if it reaches to the site of action. So after it is distributed, it is going to act on the body. After it is distributed, part of the drug is also moving through kidneys. Kidney also got blood circulation. Part of the drug again will go to the liver. Remember anatomy. Liver has got double blood supply. पहला कहाँ से आया पर लिवर को पहले लिवर ने क्या किया? पोर्टल सर्कुलेशन. Then it will be distributed all over body. All over body distributed होगा तो वो हेपेटिक आर्टरी से भी आएगा ना? That will be coming for the second time, right? So second time again the liver will do what? Again उसको break करेगा. That is what is the second path. This is what is first path, right? First path was through liver, or sorry, so portal vein. This was through hepatic artery. Why I'm talking about this? Because lot of drug that is moving through liver and kidneys will get what? Again will be killed, right? Or will be excreted. Or will be excreted. So what is happening when you consume the drug? One thing is get dissolved, it gets absorbed, goes to liver. 80% drug is what? Destroyed. 20% drug reaches to the systemic circulation. When you read from the book, ये जो 20% circulate हो रहा है, this is what is called as bioavailability. Have you heard about it? Bioavailability. Bio मतलब body. Availability में कितना available हुआ? अभी इसमें कितना available हुआ था? 20%. 20% drug was made bioavailable to be distributed all over body. To be distributed. And distribute होने के बाद क्या होता है? It is also getting excreted. This is one part. And in this particular part, we learn about what is body doing to the drug. It is not drug doing to the body. It is body doing to the drug. Drug is moving from one place to the other. From esophagus to stomach to liver to systemic circulation, then through kidneys and liver getting excreted. This is what is a part of the general pharmac called pharmacokinetics. Start reading from the notes we're going to give, because notes are very concise and you'll be able to understand each and every word through this. Pharmacokinetic मतलब क्या? Movement. This drug is moving from one place to the other. This is what is pharmac. But we don't consume the drug just for the sake of drug moving in the body. We consume the drug for drug is going to act on the body. When will the drug act? When it is getting distributed. It is getting distributed. No, because it was destroyed here itself. Only 20. So, for example, you want 20 milligram drug to be distributed in the body. How much will you take? 100 milligram. Or if you want to give intramuscular injection, how much will you give? I am coming to, because oral drug क्या कर रहा है? 80% destroy कर रहा है. If you give intramuscular, that will be directly going to blood circulation, right? So require only 20%. Right? Because of that, injectable dose is much lesser than oral dose. That is what is one of the disadvantages of an oral dose. So how do you decide the dose of the drug? Depends upon how much you want it to be distributed. अगर bioavailability only 20% है, you want 200 milligram to be distributed in the body, I'll take 1000 milligram. And because of that, most of the oral drug produce what? Loss of appetite. क्योंकि लीवर में इतना सारा ड्रग है तो लीवर क्या करेगा? और खाना मत लाने दो, मेरे को और बहुत काम है. Because that all oral drugs will do what? Nausea, vomiting, loss of appetite. If you're consuming 3-4 drugs for many years, liver do fail because of a lot of oral drugs. That is what is the disadvantage of the oral route. Right? So this was dissolution, absorption. We had first pass metabolism here. So we had a distribution here. We had a liver, kidney, and then it's getting excreted. So this particular part of the general pharmac makes you decide about what dose the drug need to be given. How will you decide the dose? Depending upon how much you want it to be distributed. This part of the drug or this part of the general pharmac also makes you decide about what frequency the drug need to be administered. And I'll spend little time here. What? Because some drugs are given twice in a day, some drugs are given thrice in a day, some drugs are given by 5 times in a day, once in a day. How do you decide that? How to decide that? Of course, that also is explained in this particular thing. Now, when the drug is distributed all over body, the drug is also moving through kidney and liver, right? So this is reducing the drug concentration, right? Now, when the kidneys and liver are reducing the drug concentration, kidney and liver are removing the drug out of the body. The amount of drug removed will be directly proportional to concentration of the drug. There's little mathematics here, but this makes us understand about something called, have you heard about half-life? When exactly the drug need to be administered? Second dose, when exactly the drug need to be administered? So when you consume particular amount of the drug, it is absorbed and it is distributed. After it is distributed, it is going through liver and kidneys. When it is going to liver and kidneys, the amount of drug removed will be directly proportional to concentration. That means, what does that mean? Concentration, if it is high, amount of drug eliminated will also be high. Concentration is less, amount of drug eliminated will also be less. So let's say when I started with 1000 milligram percent as in concentration, I'm trying to make you, these are mathematics here, but if you understand this, the frequency, the half-life is understood well. 1000 milligram percent, and every hour 10% of the drug is eliminated. 10% of the drug will be eliminated. So let's say अगर 1000 मिलीग्राम है तो पहले घंटे में कितना होगा? 900. सेकंड आवर में कितना होगा? Right? Let's say if you go with the same calculation, it takes about 6 hours to reduce the concentration to half of the original. If you go with 100 only, it will take 5 hours. But concentration reduce हो रहा है ना, तो elimination भी धीरे धीरे reduce होगा. Let's say it's about 6 hours to make it half. If I will start with a 500 milligram concentration, अभी कितना टाइम लगेगा 250 होने के लिए? पहले घंटे में कितना होगा? 400. Understand this. Understand this. 450. Second hour में कितना होगा? Right? Somebody is good in mathematics. If you go with the same sequence, 500 का 250 होने के लिए भी उतना ही टाइम लगेगा जितना 1000 का 500 होने को टाइम लगेगा. There's a little mathematics in it. क्योंकि amount of drug eliminated will be proportional to concentration. Even if I start with 2000 milligram, it requires a fixed amount of time to make it 2000 to 1000, 1000 ka 500, 500 ka 250. This concept is called as half-life. Half-life, what is the half? Is concentration half. So see, every drug has got a fixed half-life. Depends upon what is the chemical in it. Depends upon how body is managing that chemical. How body is managing. So how will you define a half-life? Of course, definition is not important, but half-life is the amount of time required by the body to reduce the concentration to half. 1000 का 500 के लिए 6 घंटा लगा, 500 का 250 के लिए भी same time लगता है. Same, because the amount of drug as you go down will be reducing also. Will be reducing also. This particular concept gives us an idea about कौन सा drug कितने frequently देना चाहिए. Understand, the drug doses are designed in such a way that when the concentration of the drug becomes half, the action no longer remains. When the concentration of the drug becomes half, action no longer remains. So how will you repeat the dose? We will repeat the dose next at the half-life. Let's say drug A has got 8 hours half-life. तो 8 घंटे बाद ड्रग का इफेक्ट चला जाएगा ना. तो what will you do? Next dose need to be given at 8 hours. That means you give 3 times a day. Drug B का half life is 12 hours. Now what will you do? 2 times. Some drug का half life is 24 hours. Give once in a day. Some drug का half life is 5 hours. अभी क्या करेंगे? 5 times in a day. That means you'll have to get up in the morning 5 o'clock. 12 घंटे के बाद दिया तो 12 बजे दिया तो still you can give 4 times in a day. See, understand? थोड़ा लेट भी दिया तो क्या होगा? थोड़ा concentration कम हो जाएगा लेकिन वो maintain करेगा वही level. We try to make it. We don't complicate these things. If the half life is 10 hours, we can give 3 times in a day also or twice in a day also. Because ऐसा नहीं होता है कि ड्रग का कॉन्सेंट्रेशन 1 मिलीग्राम से कम होगा तो एक्शन चला जाएगा. It's a range. It maintains the range. So by and large, my idea is to repeat the drug at the half life. Repeat the drug at the half life. What will happen if you repeat the drug before the half life? The concentration will keep on increasing. After the half life, the concentration will be reduced and the action will no longer be there. Can you manipulate this? Can you manipulate? For example, painkiller, diclofenac sodium, all of us know, Voveran, diclofenac sodium. Let me have an application of this so that we can understand. And there is a use of it also. Let's say commonest painkiller we give is tablet diclofenac sodium 50 milligram twice in a day. BD is twice in a day, that you all know, right? OD is once in a day, QDS is 4 times in a day. Patient says, I may not be able to remember the afternoon ka dose or second dose. Takes both the tablets in the morning. Will it work for 24 hours? क्यों? Concentration बढ़ जाएगा, लेकिन concentration बढ़ने के बाद तो तुरंत निकल भी जाएगा ना? Because remember, amount of drug removed will be proportional to what? So can you have lunch and dinner together in the morning itself so that you won't be hungry in the evening? Not even if you have double the meal, you still will be hungry in the evening. Because half life of the meal is 12 hours. ज़्यादा खा लिया तो ज़्यादा निकल जाएगा जल्दी. And we absorb. So remember that we cannot manipulate it. But the ideal way the drug can be remembered is once in a day, right? Because in the morning we can remember. Afternoon you have a class, you are traveling, the water is not there. Water नहीं है, travel कर रहे हैं, पानी ले लिया, tablet इधर अटक गया तो क्या करेंगे और? So ideal way the drug, can you give once in a day? That is what my question. So we can manipulate this. What do they do? You must have heard about some preparations, like for example, the amount of drug eliminated will be proportional to concentration. When will the drug be eliminated? After it is distributed or before it is distributed? After it is distributed. So what will I do? I will make the tablet in such a way that अंदर का is 50 milligram and बाहर का is also 50 milligram. So this tablet becomes what, 100 milligram, right? लेकिन inner core will be dissolved only after 12 hours. Oral drug. I was given the oral drug. Outer core will be dissolved in पहला 12 घंटे में. And inner core is made more compact. वो dissolve नहीं होता है. Only when the 12 hours of GI enzymes will act on it. Then it will be releasing the GI tract. Now will it work for 24 hours now? Because elimination will be only after the drug was distributed, right? Distribute होने के बाद ही eliminate होगा ना? अगर ये अंदर का 50 मिलीग्राम is in the GI tract only, so will it be eliminated? So this is what is called, you must have heard about it, sustained release preparations. The same diclofenac comes in Voveran. Have you heard about it? SR. SR stands for what? So what is sustained release means? Sustained release means it is going to release the tablet in a sustained manner. in a sustained manner. We also have this tablet can be designed in a 3 course. Outer will be dissolved in 8 hours, middle will be dissolved in next 8 hours, 8 hours. तो अभी क्या होगा? टैबलेट जो 3 टाइम लेने का था वो एक ही टाइम में लेना पड़ेगा. So ideal way to remember is this, right? Have you heard about an amino deriphyllin SR? Deriphyllin is a bronchodilator given in case of bronchial asthma. So somebody was no, last batch somebody asked me, sir ये तो 24 घंटे में तो निकल जाएगा ना? From the Karjat. This is VT. This is Kurla. The Dombivli, Kalyan, and Karjat. In 24 hours, will the drug come out? 24 घंटा drug can remain in the GI tract? रहता कि नहीं रहता है? Will the drug remain for the stool which you are passing today is the food you had when? 2 days before. Remember, drug will not come out in 24 hours. So this drug will remain in the GI tract for 24 hours. Of course, 24 hours से ज़्यादा हम लोग नहीं करते because it will come out in the stool. We cannot make it 2 दिन का एक साथ में दे दिया. It's not possible. So we can make it once in a day, but once in a day is an ideal dose because everyone can remember that. Everyone can remember. So these are preparations called as every chapter is going to have this kind of preparation because we have certain tablets which are having a very short half-life. So we cannot, for example, some drug has got 4 hours का half-life. So कभी-कभी लेना पड़ेगा. सुबह 8 बजे उठा तो 8 बजे, 12 बजे, 4 बजे, वापस 8 बजे, रात को 12 बजे, सुबह 4 बजे. Patient will say, I was better without the drug rather than with the drug. 4 घंटे में लेना पड़ रहा है unnecessary. So they make the drug in a sustained release form. So they can 3 times in a day. Right? So that we can make the drug patient friendly. So these are again some of the kinetic properties. It means we can make the drug in a sustained release form. So this is what is the concept that makes us decide about what dose the drug need to be given, what frequency the drug can be administered. समझ लो? We also have certain important things in this. Now this makes us understand about how exactly the drug can be administered. But oral was the most common route all of us know. We do also have certain other routes, like for example, every route has got their own advantage and disadvantage. Yes, after taking the routes, I will take into some pathology topic. Let me discuss, or shall I go to pathology topic? Routes, because this is what is filled up in the whole PHARMAC book. Every drug can be given by all the routes. Now in this, we're going to discuss about advantages and disadvantages of routes of drug administration, which can also be a very common question if you are preparing for your exams. The routes of drug administration. All of us know most common way the drug is given is oral route. So what are the advantages of the oral route? Of course, we all of us know it is a easy. It is also the cheap version, right? Do you require doctor to make you give the drug? Yeah, patient can himself take it. The drug also need not be sterile. Drug को sterile लेना पड़ता है क्या? Is the drug sterile? A drug, when you're handling the drug, your hands are sterile? No. Even if the drug falls on the floor, will you consume that? Depends upon the cost. 30 rupees का एक tablet है. Don't wash it and take it. You can take it. Depends upon. So the drug need not be sterile. But what are the disadvantages? We learned that in this, right? The drug takes time to act. Also, we require a larger dose. क्यों? All the drug is going to act on the liver. So most common side effect: nausea, vomiting, some different types of taste in the. Have you heard about metallic taste? हे drug घेतलं की चवच नसते चेहऱ्याला अरे आमचं जिभेला. That is what is a problem. So different types of taste. And also the absorption is unpredictable because a lot of times the food is going to hamper the absorption. Every drug need to be You need to guide the patient before food or after food, because there is a possibility that food is going to hamper the absorption. So also there is a relation of the food you're going to have. So there are a lot of disadvantages. To overcome these disadvantages, they have designed the other routes, like for example, or for the intramuscular route. All the other routes are called as what? Parenteral routes. Par stands for apart from. Enteral stands for, enteral is oral. Enteral is intestine. Enteral is mesenteric. Mesentery is what? Mesentery. Entry is intestine. Mesenteric artery, mesenteric vessels. So intramuscular route. Where do we give the injection into? Muscle. So where is the drug getting absorbed from? The capillaries in the muscle. Why do we choose the muscle only? Because muscle has got good capillary network. The drug is absorbed from the muscle directly. So all the disadvantages of this is going to be advantages of intramuscular. Time required for the drug action is less. Lesser dose is required. क्यों? Will it first go to the liver and then distributed? It directly gets distributed, right? It directly gets distributed. And the absorption is also predictable. It has got no relation with the food. खाने कभी भी खाने तो doesn't make much difference. Which are the muscles do we choose or do we select? Or कौन सा? Three gluteus muscles. Maximus. How will you identify that this is a muscle? Which quadrant of the gluteus we give? This quadrant, upper and outer. Upper and where do, if you give this quadrant, what will happen? Sciatic nerve is there. This quadrant, gluteal nerves are there. This quadrant again side, because sciatic nerve runs like this. Don't try to give into any other. A deltoid, where do we choose? Bulk of the deltoid or infection of the deltoid or this top of the deltoid? Even the bulk? Give it as the insertion of the deltoid. Because bulk may choose because the axillary nerve is there. So use the insertion of the deltoid. Right? So this was the hand. So you choose here. Don't give it here. Don't give it. Yeah. So for the children, do we give it in the gluteus or hand in case of children? Gluteus do we give children less than 3 years? Thigh. Which muscle? Vastus lateralis. If this is the thigh, this is the knee joint, choose this location. Lateral part of the thigh. Vastus, this is the knee joint. Vastus lateralis. Why do we not choose deltoid or gluteus muscle in children? Any idea? Because those muscles are not developed properly in a child. Child. What is the first exercise the child does? First thing is cycling in the air, right? And which muscles are developed cycling in the air? Thigh muscles. Because of that, we don't give it in the. And also there is an anatomical change. Sciatic nerve is more lateral in case of children. So it's a more risk of going into the sciatic nerve and can damage the lower limb. Sciatic nerve is more lateral anatomically in children than adults. So that's what these are the three sites we choose. Can we choose any other muscle? Bicep, tricep. ये तो इतना सारा muscle है, flexor muscle. Why are we not choosing those muscles? Because those muscles anatomically, first of all, there is more prone for injuring the vital structures in the muscle itself because there's a major artery in it, there's a nerve in it. So we choose these muscles because these muscles have got less chance of damaging. For example, there is a nerve in the muscle, and when you're injecting the drug goes in the nerve. What will happen? The chemical in the drug is going to kill the nerve, and nerve is killing is what? Is a permanent. वैसे पेशेंट को उसने कुछ नहीं खांसी था डॉक्टर ने इंजेक्शन दिया पूरा पैर चला गया. Today's age people are looking for, media is looking for this, people are looking for this कि इसकी वजह से मैं चल नहीं पा रहा हूँ. Now what will happen? you're going to earn for him for the rest of his life. So all those things are simple mistakes, simple things can create a lot of complications. So what should be the direction of entry into the muscle? 90 degree, 45 degree? Intramuscular. What should be the perpendicular to the skin, right? What will happen if you do 45 degree? It will not go to the muscle, it will go some other place, and that is what can create more problems sometimes. What is the maximum volume you can give by this? Maximum volume of the drug. 1 ml maximum, no. 5 ml, 10 ml. Maximum volume can be given by these routes is only 10 ml. That too, deltoid के लिए maximum is 2 ml. Deltoid is a small muscle. If you want to give more than 2 ml, choose gluteal. If you want to give 20 ml, then why are we not giving 20 ml? Because muscle will get swollen and muscle fibers will be broken, and that can create rather more problem if it is more than 10 ml. What if you are supposed to give 20 ml? 10 idhar, 10 idhar. There are various indications in which we give 20 ml of intramuscular injection. We give 10 ml here, 10 ml here. So at one site, not more than 10 ml. So advantages are the time required for the drug action is less, lesser dose is required, absorption is predictable. But the trouble is, what are the disadvantages? I'm talking about disadvantages. What are the disadvantages? It's a painful procedure, right? Arjun, can the patient himself give? Patient cannot. Even if 100 times injection you are giving, can you give injection to yourself? Remember the first year? Could you prick yourself? क्यों? वो तो एक ड्रॉप ब्लड निकलने वाला है. Could you prick yourself? When you know that needle is going to enter, not possible. And 100 pricks with no blood, anemia. It's not. And somebody will be maguna dhaka, and then you can okay, now the blood came in. So it is not possible to give yourself. So that is what one of the disadvantage. You want some injection to be given, doctor is not available. You cannot give to yourself. Also, the injection need to be sterile. Otherwise, what will happen? The injection abscess will develop. Also, the injection also pains for more time. Sometimes the activity is limited because of that muscle is swollen, and those are the disadvantages because of the intramuscular. And the maximum limit is only 10 ml, right? If you want to give more than 10 ml by this route or by the parenteral routes, which route will you choose? Will you choose intravenous? I'm going to choose intravenous. All the advantages of intramuscular will be there with intravenous. All the advantages will be there with intravenous, but technically it is easy or difficult than intramuscular. Technically it is difficult because veins sometimes are not prominent, right? You have to make the veins prominent and then you have to enter. So it is technically difficult. What will be the bioavailability in intramuscular? It's almost 95% because some drug remains bound to the muscle proteins. What will be the bioavailability in intravenous? 100%. Intravenous logically is going to act much more faster, a little faster than intramuscular. Here the advantages we can give liters of the blood or liters of the fluid. Patient is in dehydration, you have to IV fluids. You do intravenous route, you do intramuscular. Liters of the fluid, muscle will get swollen. That is what is an intravenous route. Another advantage is we can keep the needle or catheter inserted into the vein for a longer duration to have a repeated injections given. Admit वाले patient को हम लोग देते ना? We keep it for 3 days, 5 days. Can you give the needle in the muscle? वो कल भी देने का तो needle रख दो अंदर. Not possible. That is what. Why do we not choose an artery, intra-arterial? Arteries are deep. Arjun? Arteries are deep. Pressure in the artery is how much? Very high. Pressure is very high compared to the vein. कितना रहता है vein में pressure? Only 20 millimeters of mercury. And artery में 120. Blood pressure कितना रहता है? 120, right? This was 120. Because of that, it is difficult. If you puncture the artery, it will keep on bleeding for more time. So we usually do not choose an arterial one for drugs. In which conditions I will choose an artery to be pricked? Only for the investigations in the ICU called an arterial blood gases, ABG it is called as. Or you are doing an angiography procedures. You must have heard about angiography. They put the dye in the vein, artery, and they take an X-ray for heart and those other indications. So this is not for pharmacological use but for diagnostic use. तुमको देखना है कि आर्टरी वाले ब्लड में ऑक्सीजन कितना है. Can you take the venous blood and know आर्टरी में कितना ऑक्सीजन है? Not possible. It is like asking the other person कि उसका बैंक में कितना बैलेंस है. We don't know. So we'll have to prick the artery. But this precaution need to be taken so that the puncture site will not bleed for more time. Another important thing is the wall is very thick, right? Vein ka wall. If you have this and this, which is artery, which is vein? A and B. A is artery. A is the vein. And then artery. Because wall is more thick, right? Difficult to negotiate and go to the lumen. And because of that, and another important point is artery में blood कहाँ जा रहा है? Away from the heart, towards the heart. So it will go from, so if you get artery here, it will go here and then it will come back, right? There's another reason. Apart from that, just superficial to the muscle, we also have a layer called a subcutaneous root. Subcutaneous root. When will you give injection into a subcutaneous root? Subcutaneous में क्या है? What do we have? Which layer is this? Which layer is this? It's a fat layer, right? Subcutaneous tissue and fat layer. Why do we give injection into a fat? Fat को blood supply कम है कि ज़्यादा है compared to muscle? Very less. It's hardly 2 to 3% of the muscle blood supply. अगर blood supply कम है तो क्या होगा? There has to be a reason why we're giving it here, right? Absorption will be slow. Why do you want absorption to be slow? You want the drug to act for a longer time. So which drug will you give? Especially those drugs which has got a very short half-life. नहीं समझला? We give the drug into a fat layer because the blood supply is less. The blood supply is less, absorption is slow. And the absorption will be slow, the drug is going to act for longer time. So especially those drugs which has got a very short, what is the half-life of insulin? Only 4 minutes. 4 minutes is a half-life. So if you give insulin by intramuscular, every 4 minutes you have to give. Half-life के बाद उसका action कम है ना? Patient will say, I was better with the insulin, diabetes rather than this. So insulin half-life is 4 minutes. Insulin how do we give? Remember that it is always given before lunch and before dinner, right? आता जेवायला बसायचं तर आजी इंजेक्शन घेऊन या जेवायला बसायचं. Before lunch and before dinner, 12 hours, right? How can a half-life of 4 minutes act for 12 hours? Only if it is given in subcutaneous space. Only if it is given in subcutaneous space. Which other drugs? Adrenaline, will we give? Subcutaneous route. Adrenaline is also subcutaneous. Emergencies, adrenaline is given subcutaneous route. In fact, all the natural hormones, growth hormone, we're going to learn about the other hormones. If you give drug hormones as an injection, always given in the subcutaneous, because all natural hormones have got a natural half-life very less. Very less. So because of that, we choose this particular route as a subcutaneous. And what should be the angle of insertion? 45 degrees. 45 degrees. Now, All this is also explained very nicely in an images. So after every lecture, I will forward you the images related to that on a group, on a WhatsApp group. We're going to make a separate WhatsApp group so that you can also revise all those things what you have learned in those images. Make it a habit that you store those images in a Google Drive so that you can also revise it later on. So even through the images also, you can just flip the images and you can understand things very well. That was subcutaneous route. We also have, what is more superficial to that? Dermal. So will you also give intradermally? Again, intradermally in the sense when? Where? In the skin. This is below the skin. So if you want to give, you just lift up the skin like this and you give below. यहाँ से injection दो. So it goes below the skin. This is not in the skin. Now this is what? Intradermal is what? In the skin. In the skin. So will it be more painful, less painful? Sensory nerves किधर है? Subcutaneous tissue में है कि? Have you ever taken intramuscular injection? You must have taken some time, right? When does it pain more? During insertion or after the needle has gone? Little bit. During insertion. When the skin is negotiated, it doesn't pain. So where are the nerves? In the skin. Remember that. Sensory nerves are there in the skin, not below the skin. Not below the. So if you give injection in the skin, will it pain more or less compared to subcutaneous? It will pain more. In the skin also, the tissues are very tough. Chamda hai na? Very tough. Drug will not be absorbed very easily because drug is going to remain bound to the skin. How do you know that you are, let's say this was the skin, this was a subcutaneous tissue, and this was a muscle. When you are going in the muscle, go by 90 degree. When going in subcutaneous tissue, go by 45 degree. When you want to go in the skin, go almost 10 degrees parallel to the skin. And how do you know that you are in the skin? When you inject the thing, it will raise a bleb on the skin like this. It will raise a bleb on the skin. Have you ever seen the BCGs being given? It raises the bleb on the skin, right? थोड़ा सा ऐसा पांडरा काहीतरी dot दिसतो. So that this drug is in the skin and it is not getting absorbed also. And it is more painful also. So why do we give this route? Just to punish the patient? नहीं आता घे तू त्रास देतो ना घे give 5 ml in the skin. Skin is going to rupture and come through an ulcerated skin. So why do we give in this location? What is the reason behind? Because yes, right? Because this drug is going to remain in the skin, and if the patient is allergic to the drug, what will happen? This will develop the allergic response in the form of an erythema, redness, and swelling. This drug is not going to get absorbed in the systemic circulation. So to know the allergic response to the drug, whether the patient is allergic to the drug or not, you give a test dose by this route. We don't give it for systemic action. हमारा डोकं दुखता है, पेन किलर द्या, not in the skin. Should be done intramuscularly. So intradermal is chosen for knowing the allergic response. Hypersensitivity reactions. Hypersensitivity reactions. We also have the other routes, like you must have heard about sublingual route, for rectal route, and for vaginal route. Sublingual, for rectal, and for vaginal. Where is the drug getting absorbed from? See, we require at least 6 to 8 hours to know the primary immune reaction. So usually you must have seen tomorrow morning if some patient is going to get operated. So give it today in the evening some allergy. Tomorrow जो भी drugs use करने वाले हैं अगर उसका allergy हो सकता है तो today night you give. Today night you give. So maximum you require 6 to 8 hours. Drug will remain here, drug will getting destroyed. Immune response is going to destroy it. Drug will not be remaining here for longer duration. If you give by intramuscular route, even reaction will come earlier. क्योंकि intramuscular में blood supply ज़्यादा है ना. But what is the risk? It will also be absorbed all over body. So allergic response कहाँ मिलेगा? All over body. Do we want that? And can it be seen also? Intramuscular दिखेगा क्या सूज रहा है? Because we choose the skin intradermally so that we can see the allergic response, right? And we give a very small dose. For example, normal dose for the injection is 5 ml. So give only 0.1 ml here, 50 times lesser than the actual dose. 0.1 ml, only 0.1 ml. Normal dose 5 ml रहेगा तो. That is what is a test dose or sensitivity tests. What are the other routes? Sublingual, rectal. Where is the drug getting absorbed from? Sublingual मतलब where do we give? Below the tongue. What is the advantage? Where is the drug getting absorbed from? Mucosa. Mucosa has got a rich capillary network, and mucosa has got a very thin layer of the mucus layer. So the drug goes through the mucosa, goes in the capillaries, and will be absorbed from the capillaries. So whichever mucosa that looks pink in color, all those sublingual, perrectal, and pervaginal. So will the absorption of the drug will be as fast as intramuscular? As fast as intramuscular. Depends upon the molecule. If the molecule is very low molecular weight, it will be going easily into the mucosa. High molecular weight, taking more time. Also, depends upon the preparation of the drug. A lot of times we give a tablet crushed under the tongue. Crush the tablet and put under the tongue. The tablet is going to absorb very slow, right? Or if it is there in the gel form, or if it is there in the oil form under the tongue, absorb faster. If it is a mouth spray, more fast, because mouth spray is a volatile thing, right? Absorbs. So, but its absorption is faster than oral route. Much faster than the oral route, rather. Much faster than the oral route. Can the patient himself take it? Yes. So why not give all injection by this route then? Intramuscular के इतना painful भी है, doctor भी लगता है, doctor का wait करना पड़ेगा, और also दुखेगा. Will it pain? It won't pain. So why don't give all drugs by this route? क्यों? Dose ये भी direct blood circulation में जा रहा है, ये भी direct इधर जा रहा है. First of all, sublingual में can you give bitter drug? All drugs are chemicals, right? कड़वा है, तिक्कट है, and all those things. And sublingual route. Also, it adds saliva will be added, right? So drug is going to get diluted. Patient is not going to keep it saliva. No, थुकायचंच नाही. Tobacco is the commonest drug given by sublingual route. They put it here, right? They're taking the sublingual route, and they keep it here. No, you talk to them. And there you go, half a bucket they come out, the saliva and all this. So this is sublingual route. But the trouble is the salivation, the taste. So why not use perrectal route then? The drug is not going to remain for a longer time over there because the defecation is going to come out. And also it's an unhygienic thing. For vaginal, again the private parts are getting exposed. So better to choose an intramuscular for most of the things. Advantage of this sublingual is, the most important advantage is, the patient himself can take it. It is the parental route in which patient himself can take it. So when will you require this? When the emergency is there and the doctor is not available. Commonest example of this, have you heard about that nitroglycerin? Patient has got chest pain, angina pectoris, angina, in which oxygen delivery to the muscles is less. You are required to dilate the arteries as early as possible. They take some spray, and patient has got relief of the symptoms. And immediately the coronary arteries will dilate, blood supply will be not. We are going to learn that during cardiology. Also, patient come with blood pressure 200 by 120. तुम्हाला एकदम ब्लड प्रेशर खाली करायचं as early as possible. नाही केलं तर काय होईल? कुठली तरी आर्टरी फुटणार and patient will produce hemorrhage somewhere. In that case, we choose a sublingual drugs to reduce the blood pressure before the patient comes to ward and getting admitted and all this. So these are some emergency procedures. Some of the emergency procedures. Let's see, another example is, patient has come to with convulsions. Can you give intramuscular route? Muscles are tight, right? Needle टूटना. There are a lot of things. Needle टूटते. Muscles are very strong. So patient is throwing conversion. Can you give intramuscular? Can you give intravenous? क्यों? Shaking, right? You कुठे nerve हे कुठे? Can you give oral? दात किती बसली आहे? You cannot break the teeth and then we choose per rectal route. Give anticonvulsant drug by per rectal route, break the convulsion, and then start the intravenous route. So these routes are chosen in special situations. Some of the special situations. These routes are chosen in the special situations. Remember that. Do we have any other routes? हाँ चालू है? हाँ 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 लटक दे तो बंद झाला पूर्ण बंद डेड some message will be there right gasping वर आहे ऑक्सिजन लागणार ठीक आहे so do we have any other route? Have you heard about the patches, transdermal patches? We also have a special routes called as transdermal patches. What are those drugs? Transdermal patch. Oh, ऐकलं का? Samsung S6 दे. What are transdermal patch? We apply the drug in the form of the band-aid से patch है ना band-aid. So the drug is stored in the band-aid. Band-aid का patch. And the drug is delivered on the skin. Will it be easy for the drug to be absorbed from the skin? Like mucosa में absorption is quick because mucosa, a thin layer of capillary mucosa, and then we have capillaries. Skin ka how many layers are there? Epidermis and dermis. Together we have 7 layers. Is it very easy for the drug to go through 7 layers and getting absorbed? It will be very slow. So why do we choose this route? We apply some patch on the skin. The patch, let's say this was a patch, and we are seeing the patch from side, a thickness of the patch. The drug is stored here. The drug has got a plastic coating on it so that the drug doesn't go out. And on the skin side, we have a permeable membrane through which the drug is very slowly coming on the skin and getting absorbed very slowly. When will you require this? The drug will be stored in the drug compartment. There is a permeable membrane through which the drug is coming slowly on the skin and getting absorbed. Will it be acting for a shorter duration, longer duration? Very long duration. It is going to maintain very steady concentration क्योंकि सबलिंगुअल देते हैं तो क्या होता है सलाइवा में डाइल्यूट हो जाता है रेक्टल देते हैं तो क्या होगा एक दिन में निकल जाएगा because every day you pass the stool right per vaginal also is an unhygienic thing so we give by this route even the drug can be delivered through this layer for 7 days you apply the patch will remain for 7 days usually this route is chosen for a special indication like for example a painkiller patch for an anti-cancer patient or cancer patients whole body is paining like hell we cannot give painkillers also patient is almost on the verge of dying so let him die peacefully so we give a morphine here the morphine pethidine patch painkiller patches are there we also have patches for hormones reproductive hormones OCPs gynecology patch lab it is not very famous in or not very common in a developing country like in India ka? First of all the cost is very high and second if it comes out because of sweating then you cannot reapply it it is disposable comes out gone so cost is very high and you cannot reapply it more common in the foreign countries abroad where we have special patients which may require this as the route of drug. Now how do you choose any of these routes? How will you choose any of these routes? Depends upon patient's requirement. We understood about the advantages and disadvantages. So we can come to know that which route the drug need to be given. For example, patient comes with mild headache, again oral drug. Throbbing headache or maybe a fracture and fracture ka pain, again oral drug, again intramuscular drug. Thoda sa headache and you give intramuscular, what will happen? That is going to pain more than this. So remember, we choose the drug depends upon patient's requirement, patient's urgency. For the patient is vomiting very frequently, what will you do? This oral, I can IV drug. When the vomiting stops, then I can give oral drug. So you choose the drug depending upon patient's requirement and patient's conditions. Patient's conditions, right? So this was a little, I can say, little part about general pharmac. We have a lot of other things. How exactly drug acts on the body. When will you combine two or more drugs together? What are the other side effects and adverse effects, complications because of any drug? When will you not combine two drugs together? What are the drug interactions? Because that is what is all knowing all characters in this serial. When you know all these characters, then the pharmac becomes more interesting. Right? So let me have some more topic on pathology. Not very powerful. 15 minutes? I won't change this. Okay. So that you can also understand about what in pathology you're going to learn. So that you can decide what you, how exactly do you want these lectures to be delivered. What's the maximum time you can be there in the lecture so that we can plan? 8 o'clock? 8:30? I know you are all, your regular college is also there. That too an heavy dose. And this becomes 8 o'clock will be okay? For the other days, for the regular days, that's what. So we can plan things accordingly. So let me make you understand about what we're going to learn in pathology. Pathology. Because what do you mean by pathology? Pathology is all related to the abnormal anatomy. Remember that pathology is abnormal anatomy. Because in the first year, we already have learned what exactly is anatomy. And I hope you all remember that. Neuroanatomy, very good, you are all neuroanatomy. Last moment, what are the most important thing? Tracks, CSF, Azun cerebral cortex, bus. Not more than that. So pathology is what is abnormal anatomy. Now what is abnormal? To know pathology, we need to understand about what is normal. Can you identify what is abnormal with the tissues if you don't know what is normal? It's not possible. So we compare the organs or compare the tissues from normal to an abnormal side. Why it is important? When you know what is the pathology in the organ, we come to know about what is the disease will be there in the organ. And we also come to know how can you treat that particular disease. Let's say, for example, the first topic in pathology, I want to take not more than 15 minutes. Or till 8 o'clock will be okay? Yes, it's not that important. Okay, the first lecture, I'm not going to make you think more. In 15-20 minutes, I'll make you understand about what exactly the first topic we're going to learn about. Abnormal anatomy. Now, we all have understood that human body is made up of what? Systems. We are that 10 to 12 systems, right? Respiratory system, cardiac system, all of that. Every system is made up of what? Organs. Every organ is made up of what? So the first topic we would learn about the cells. Because when we study cells, indirectly we study systems and organs. So the first topic in the pathology topic is a cell present injury. Right? Cell injury is the first. Have you started reading from pathology book? Hirschman, Robbins, big book. Or even if you understand whatever you're going to cover, there will be more than enough at this particular stage. So cell injury and cell adaptation. Cell injury and cell adaptation. Now what we're going to learn in this. Now we all have understood that a normal cell has got certain components. Like for example, we all know what is that. We have a cell wall, we have a nucleus, we have a cytoplasm, right? You also have certain this mitochondria. We also have something like this, ribosomes, some Golgi apparatus and lysozymes. Every of the cell organ has got their own importance. Cell wall is important for protection. Nucleus is important for maintaining the DNA and RNA. Nucleus is what decides what is the cell supposed to do. When the cell is supposed to divide, it divides through the nucleus. It doesn't divide through cytoplasm because the nucleus has to undergo mitosis and all this. Mitochondria क्या करते हैं? Powerhouse produces the energy. What do the ribosomes do? Protein synthesis. What do the Golgi operators and all those things do? Again, important for metabolic processes. So synthesize something. What are the enzymes for lysozymes? Again, for digestion and absorption of the vitamins. So this is what cell organelles we are talking about. This is what the normal cell. This is what we have learned in the first year. Physiology as well as anatomy, histology, for example. Now, in this particular topic, we're going to learn about what will happen when the cell is undergoing injury or cell is going to get injured. Well, that is what is pathology, right? When cell is undergoing injury, there are certain changes that will occur in the cell, and that is what we are supposed to learn in the cell injury and cell adaptation. So normal thing से हटके अपने को क्या मिलेगा? What will we get? That is what is cell injury. Now, what can be the types of cell injury cell can undergo with? We have, what are the types of injurious agent we know of? We can be a physical injury, right? Let's say there was a trauma. Cell is going to get injured. Or it can also be a chemical injury. It can also be biological injury. Like for example, microorganisms. We have an ulcer here. We have a boil here. We have the abscess here. What is that? Abscess is an injury because of what? Microorganisms. It can be bacteria or viruses. It can also be radiational injury. It can be ultraviolet radiation is going to produce certain thing. It can also be, what are the others? Electrical injury. These are all injurious agents, right? Now, injurious agents are going to attack on the cell, a normal cell. We are going to learn about what will happen when this injurious agent is going to attack on the cell. What are the changes that will occur in the cell? What changes will occur in the cells? That is what is the first lecture called as cell injury and cell. Now, what are the factors does it depend upon? कि cell को क्या होगा? What factors does this depend upon? First, मतलब cell को क्या होगा depends upon what? First, strength of the injurious agent. What does that mean? Injurious agent का strength अगर ज़्यादा है तो what will happen to the cell? The injury is going to be more. When you are fighting with someone, who will win depends upon what? How stronger is the enemy. If the enemy is more strong, it's going to injure you more. If you are fighting with tiger, what are the chances of you will win? Because enemy is more powerful than you, much more powerful, right? So what will happen to the cell depends upon first, strength of the injurious agent. Second, strength of the cell itself. Cell कितना अच्छा है, cell कितना healthy है. If the cell is more healthy, chances of cell damage is more, right? Less. If the cell is more healthy, chances of cell damage is, that means you are listening. Okay. Strength of the cell. Now, amount of injury produced will be directly proportional to strength of injurious agent, and it will be inversely proportional to. What is the third thing it depends upon? Third thing is amount of time the injurious agent is acting on the cell. अगर टाइगर आ भी गया लेकिन वो सिर्फ 1 सेकंड के लिए है, क्या होगा? 1 सेकंड ओवर नहीं, गो, अभी 1 सेकंड हो गया. Will it injure the tissues? Not possible. But if the dog is and dog is